Pregnancy complications are health issues that arise during the course of the pregnancy. They can affect the health of the mother, the baby, or both. Some women have health issues that occur during pregnancy, while others have health issues that could lead to concerns before becoming pregnant. To reduce the risk of pregnancy difficulties, women should seek medical attention before and during their pregnancy.
One day, a married couple came to the hospital, a man and a pregnant woman. The woman is 25 years old and 7 months pregnant. They came to seek for medical help. The pregnant woman seems to be not feeling well and is observed having some difficulty handling the situation. A nurse was actively concerned that a pregnant woman may be diagnosed to something that is not right for a pregnant woman to experience. She immediately checked on patient's urine and assessed her feeling and her baby.
So good morning, ma'am, sir. How may I help you po?
We just want to check the status of our baby and the status of my wife.
Okay, so can you please stay right there so I'll be able to prepare the face. Good morning, ma'am. I am Nurse Rihanna and I'll be the one to check you and your baby today. How would you like to be addressed now?
Just call me Mrs. Lee.
Okay, Mrs. Lynn. What brought you here in the hospital?
My wife told me that she's experiencing nausea and total headache today. We thought that it's normal for a pregnant woman, but today she's experiencing abdominal pain. We are worried that there might be something happening to our baby.
Okay, sir. Just stay calm and let me talk to your wife first. Okay?
Sure, nurse, but since we have a short misunderstanding, she doesn't really talk to me.
Okay, sir. Don't worry. Let me talk to your wife first. Okay? So, hi, ma'am. Ma'am. Hi, I'm Nurse Rihanna and I'll be the one to check you and your baby today, okay? And is it okay to check you for a while?
Okay, no problem.
So, ma'am, what do you in the hospital po?
I feel unwell physically and mentally.
Okay, ma'am. Would you like to tell me more about it?
Yesterday night, my husband and I were arguing about some stuff. And I began to experience abdominal pain in my lower belly. And lately, I have been feeling stressed.
So, ma'am, can you rate your pain yesterday on a scale of 1 to 10?
I would rate it as 4.
Okay, ma'am. So, 4 is considered moderate pain. And you don't need to be concerned about your baby because experiencing low belly pain is normal if you're pregnant.
Okay, that's great here.
You look unhappy, ma'am. What is that?
I would be happy if one of the reasons why I'm here was my husband, who is constantly arguing with me.
Ma'am, if you want to talk about your feelings, I'm always here anytime, okay?
At this moment, the nurse will assess the client's vital signs. The patient was cooperative and was very attentive when interacting with the nurse. This is where the nurse will explain that she has been diagnosed with gestational hypertension, including its symptoms.
Is it okay, ma'am, if I check your vital signs? Because I need to check your vital signs for me to be able to help you.
For what purpose? Is it totally necessary?
Yes, ma'am. It is very, very critical for us to assess you so that we can determine if you and your baby is at risk of complications.
Okay.
Owing to your consent, ma'am, I would like you to feel relaxed while I'm taking your vital signs, okay?
The nurse is currently taking the vital signs. After a minute, the nurse had finished taking notes and gathered the client's data.
information I gathered from you while I checked your vital signs, it appears that your blood pressure is abnormal. It is over the range of the typical normal range of a pregnant person having this kind of blood pressure. And then your temperature is normal, by the way. So yeah. Your heart rate is also acceptable in the range of 60 to 100 beats per minute. Your respiration is 12 to 20 per minute also. And that, with the exemption of blood pressure, all of your vital signs are deemed normal.
What? What should be the reason why my blood pressure is increasing?
Okay, ma'am. You said earlier that you have been feeling stressed lately, is that correct?
Yes, ma'am. And you also experience any kinds of these symptoms such as nausea and vomiting and then frequent urination or blurred vision, is that correct? Okay, ma'am. It seems that it appears that you are suffering indicators of gestational hypertension. This is a type of hypertension caused by stress.
So, what should we do, nurse?
Sir, Mrs. Celine must avoid becoming stressed in order for her to maintain her blood pressure. And she also needs to drink at least 8 glasses of water a day and also enough rest. Since Mrs. Celine is at risk of having preeclampsia, this is a condition that can result in a newborn baby having low birth weight.
Isn't it better if I stayed in the hospital?
Yes, ma'am. For me, it's very strongly advised for you to stay in the hospital so that we can observe your health.
Naka na.
Oh, sir, good day. I just want to remind you about your wife. Your wife has been diagnosed with gestational hypertension, as you can see, and I just want to remind you that please stay away your wife from stress.
Okay, nurse, but I have one question. Why did it happen to my wife?
Okay, sir, as you can see, your wife has been displaying symptoms of gestational hypertension, such as moodiness and weaknesses. And she needs to stay away from stress because it will lead for her blood pressure to rise. And then, if it will not be addressed immediately, she and your baby, the baby in her womb, will be at risk. So I highly recommend that you will stay by her side, keep an eye on her, and then please really stay her away from stress.
Thank you so much, nurse. I shall remember it. Please help in any way you can.
Yes, I assure you that I will do anything I can help.
Good day, ma'am and sir. Sir, you can please sit at the corner of the room while I evaluate the missus. Ma'am, would you like to please take a seat? Hello, ma'am. My name is Nurse Kira, and I'll be checking your health, particularly your blood pressure, ma'am.
Where is Nurse Rihanna?
She is currently at the operating room, but do not worry. I have been assigned to examine your health in her place. Is that all right with you, ma'am?
Yeah,
So how are you today?
good. I didn't feel the same way I did the other day.
That's wonderful news, ma'am. According to Nurse Rihanna, you are currently suffering from gestational hypertension and your blood pressure is a little high. Is that correct, ma'am?
Yes.
Okay, ma'am. Now I'm going to be taking your blood pressure.
The nurse is taking the blood pressure of Miss Celine.
Ma'am, your blood pressure is already within normal limits.
Wow, thanks God.
Now, ma'am, all you have to do is to avoid getting stressed and make sure you continue to stay healthy. Have a good day, ma'am.
Okay, thank you.
Our story revolves entirely around the working phase. The nurse and the client collaborate to help the client to identify the patient's stressors. Because this relationship exists for the client's benefit. It is critical that the nurse uses self-therapeutically at every interaction. The nurse will also assess the client's behavior and focus on the interaction of the client's feelings. The nurse helps the patient to develop coping skills, a positive self-concept, and independence in order to change the client's behavior to one that is adaptive and appropriate.